you or a loved one suffers from obstructive sleep apnea, which is when the muscles in your throat cannot support their weight while you're sleeping, you're probably using a CPAP machine. Often, a first sign of sleep apnea is someone complaining about your snoring. You might also notice feeling restless and run down when you wake up, often accompanied by headaches and other signs of not receiving enough oxygen at night. Sleep apnea is a very serious and potentially life-threatening disorder. Weakened throat muscles tend to close up, and breathing can stop for extended periods of time. If you believe you have sleep apnea, wake up feeling tired, or have a sleeping partner that has noticed you stop breathing at some points during the night, we recommend visiting your doctor. Your doctor can run a series of tests to help determine the safest and most effective sleep solution for you. If you have sleep apnea and you happen to suffer from COPD or other lung diseases, you may require oxygen therapy while you sleep as well. Fortunately, you can easily connect your oxygen concentrator to your CPAP machine and use them simultaneously. You'll need your CPAP tubing, a bleed-in adapter, a CPAP mask, open-ended tubing, your CPAP machine, and your continuous flow oxygen concentrator. In order to properly connect your CPAP device to an oxygen concentrator, you'll first need to evaluate the type of CPAP mask you have. Some masks feature an oxygen port. However, most masks do not and will require a small and inexpensive device called an oxygen bleed-in adapter. If your mask has an oxygen port, it may be covered with a small cap that you will be able to remove. Remove the cap by gently twisting and pulling until it pops off. Next, connect your CPAP tubing to the tubing of your CPAP mask. Wiggle the rubber end of your tubing onto the plastic tube of your mask. Make sure the rubber end is pushed forward until it reaches the first level indentation on the mask tube. Then grab your bleed-in adapter if needed and secure it to the opposite end of your CPAP tubing. Make sure you push the rubber portion of the tube as far forward as it comfortably allows. Next, connect your tubing for your oxygen concentrator to the small end of the bleed-in adapter. Push the end of your tubing firmly over the first knob until secure. Connect the other end of the tubing to the concentrator. Note that only continuous flow oxygen concentrators are compatible with CPAP machines. Pulse dose oxygen concentrators cannot be used here. All home oxygen concentrators and some portable oxygen concentrators provide continuous flow and are compatible. Finally, connect everything to your CPAP machine. If you're not sure where to connect the tubing to your machine, refer to your owner's manual for individualized directions. Also, be sure not to allow oxygen flow into the CPAP machine if the CPAP machine is not running. Here's some more things to know if you need a CPAP machine. When getting a CPAP mask fitted, make sure you have enough time and energy, as the mask may need to be readjusted a few times before it sits comfortably on your face. Be aware of the location of your machine's filter and be sure to replace it often. Make sure your mask is snug and not too tight, as tightness will cause soreness and temporary strap marks on your face. Use a mirror the first few times you put your mask on. You'll want it in the right place so it works correctly. Always turn on your CPAP or BiPAP machine before turning on your oxygen concentrator. Always turn off your oxygen concentrator before turning off the CPAP or BiPAP machine. Replace your mask's nasal pillow or cushion every 6 months for hygiene. Don't worry about leaks in your tubing. Many CPAP machines have leak sensors that will alert you and adequately increase pressure. Do not settle for an uncomfortable mask. Get one that's comfortable. Don't use alcohol or vinegar to clean your mask. Simply use a mixture of mild soap and water. If you sense any nasal dryness or a sore throat, we recommend using a heated humidifier to moisten the air. If you have any other questions about your CPAP machine or oxygen concentrator, our oxygen experts are standing by, ready to help. When you breathe easier, we breathe easier.